We do hip replacements when patients have arthritis of the hip, which is essentially loss of cartilage. So this is an example of a hip joint. Typically, there's normal cartilage on the ball, normal cartilage on the socket, such that in a normal non-arthritic hip, it is cartilage on cartilage. With arthritis, the cartilage wears out and it becomes bone on bone. Sometimes with the development of some bone spurs, oftentimes these are what decrease patients' range of motion and can cause pain. Hip replacement entails removing the ball, preparing the socket, and then placing implants such that the new joint is metal on plastic. We use metal and plastic parts. This is an example of a stem that would go down into the into the femur. The socket is prepared to size-specific sizes and then placed into the socket. And then a piece of plastic, a hard plastic, locks into that metal liner. This is an example of a half of pelvis. In this case, a ceramic ball on a plastic liner that now recreates a new hip joint, allowing for painless range of motion and improved function. There are a lot of different ways to place a hip replacement. Bottom line is you've got to get the parts in good position. Traditionally, there's an approach from the side. There's one approach from the back, what we call a posterior approach. More recently, some surgeons are doing what we call an anterior approach, and even more recently, perhaps, what we call a direct superior approach, which is what I do. It's a modification of the posterior approach. It's done through a smaller incision. It's done a little bit higher up in the hip, which allows us to minimize the tissue damage associated with the traditional posterior approach.